Tell us how important Medicaid is, if you have any thoughts on that or anything else you'd like to share with us.
Thank you. It's my pleasure to be here. It's an honor to be at a city college because I also started my journey in a city college, went on to UC Davis, and then, of course, medical school, coming back to a community that I grew up in, that I would want to support. And it saddens me that we are at this juncture where someone is actually threatening to take away the very basic necessity, very basic offering, very basic thing that all of us work and hope we can provide for ourselves as we grow older, or for our children as they grow older. So what's at stake? I'm gonna walk you through this journey. You know, some of you may actually be Medicaid recipients, Medi-Cal recipients, Medicare recipients at this point. But if you're sitting there thinking, it's not gonna affect me, think again. Think of your child who is now, remember, up until 26 years of age, is under your insurance. But the minute they hit 27, unless they have a job that covers or provides insurance for them, they have to get insurance themselves. And that's where this comes in. Now imagine your child pregnant, not able to get medical care, your grandchild not able to be supported, not only in the pregnancy, but afterwards. And if that child happens to be in a rural community where more than 60 to 70% of the population is dependent on Medicaid, where we have the OB deserts, and we call them deserts because just like in a desert, you can't find a place, maternity care, obstetric care, gynecologic care, for miles and miles, now has to go and find a place where they can actually take care, even if they have the insurance, be able to find a provider to provide that insurance. And of all our seniors who are in the nursing homes right now, Medicare, Medicaid, Medi-Cal, all of these services are important for them to get the care they get. Majority of our nursing homes depend on Medicaid to be able to provide the services. What are we gonna do with Granny? Throw her out on the street just because there's no coverage? Or do we take them back in, but then who takes care of them? How many of us will actually have to let go of our jobs or cut back on our jobs, cut back on our income so that we can take care of our parents because they deserve the care because they took care of us when we were little. All of that is dependent on these cuts. So yes, there may be big numbers, and I'll give you numbers since we are talking about those. About 15 million Californians are at this point covered by Medicaid. That accounts for about 38% of our population. Half of our kids depend on Medicaid, especially if you're a disabled child, if you happen to be the parent of a disabled child. A lot of the services you're getting are covered by Medicaid. Think of, would you want those services to go away? Probably not. 2 in 5 people with disabilities are covered by Medicaid. 2.2 million seniors, and I see many gray hair, just like my hair is turning gray. We're all looking at that time when we'll be needing this help, right? Are covered by Medicaid. And approximately 170,000 veterans are covered. All of them stand to lose the coverage they have. So they lose the coverage, what happens? We're not doing our preventative care, cancer is being missed, or delay to diagnosis of that cancer is being missed. I'm sure you've read the newspapers where we see cancer coming and being found in younger and younger population. Guess what? It's not just the seniors that are at risk. When you're talking about the mid-age, 40s, 50s, that's where we're missing it. We're basically cutting the lifeline of people by delayed diagnosis. And when you don't have insurance, what happens? Because eventually you will need care. But where will you go for that care? To the emergency room, right? We don't have docs there, as many of them as we used to, because there is really a healthcare workforce issue that's in place right now. On top of it, we're creating a situation where we can't support this, right? Not only does the person who went to the emergency room end up with a debt, that they can't cover, that they go into financial issues with. The health system cannot sustain this. So we end up closing more healthcare centers, more private practices, more group practices, and suddenly the desert just spreads beyond those areas where it is now. Because we didn't provide the support we need to make sure we were able to provide care to our families and our people when we needed them. And when you look at it, and we actually, and I read this, we give this to our anybody who listens to us, literally, about, if you think Medicaid is just at the point of I lose my insurance, it isn't. We just talked about what happens to the patient that lost the healthcare coverage. Well, the emergency room that got more crowded, things were delayed. That MI that came in, that heart attack that came in, the stroke that came in, that I should have acted on in 30 minutes, it took me 3 hours because it was so delayed. And now we have some long-lasting issues. What about the patients who were forced into debt? They're losing their homes, they're losing their earnings, they're having to move, change their lifestyle, become homeless. All because of medical debt. I'm sure there are people here who have stories of people they knew way back when, 20 years ago, that lost their savings, that lost their home, that became homeless, had to move in with families because of medical debt. We made changes to prevent that, and now we're going 3 steps behind to make sure we actually are worse than what we started out with way back then. What about the commercial insurances? Of course the rates are soaring, right? They're gonna go up. And when that goes up, guess what? All of us who are not low income, who can afford some insurance, now are putting more money away for insurance than we were before. And then of course the hospitals and the physician office closures that I talked about. But all of this, what happens when a big medical system, a health system closes? How many jobs are lost? Our communities, you may think of it as acting independently, but really it's affecting our entire community when we lose those jobs. And so, a burden falls on the state. A state that is already burdened with and putting in lots of services, working hard to make sure they can provide the services. When the federal match happened, when the Medicaid expanded, there was, in order to make sure that the states expanded their Medicaid program, the Fed said, we'll match you 1 by 1, right? So 1 to 1. So $1 you put in, $1 we'll put in. When this, or if this goes into effect, they only put in 30 cents. Can the state absorb that nearly 70-cent deficit per person that's going to come back into the system? How many services will we stand to lose? I want all of you to think of that and vote thinking of those things. I'll be here delivering babies. I'm an OBGYN. I love doing my job. I'll be here helping all the women, as many women and teenagers as I can.
Yeah.
But we need to stand up and vote against this. Speak up now. We have a voice. Let's use it.
Thank you, Doctor. Wow.